Welcome, everyone. Today, we are unpacking a brand new skill, one you're absolutely going to need to stay safe and informed in the age of AI health.
Okay, let's just dive right in with a question. And, be honest with yourself here. Have you ever used an AI like ChatGPT for some health advice? If the answer is yes, well, you are definitely not alone. And that's exactly why we need to talk about this.
So on one hand, this technology has incredible promise, right? I mean, it can take a super complex medical document and simplify it in seconds. But, and this is a big but, there's a serious hidden risk. These AIs can confidently, and I mean confidently, state things that are just plain wrong. Researchers call these hallucinations. And when we're talking about your health, that can be, well, incredibly dangerous.
And this new challenge means that, honestly, our old skills are kind of becoming outdated. The way this AI works is just different. It demands a specialized upgrade to our digital toolkit. Just being good with computers or knowing how to use a search engine, that's not going to cut it anymore. So, here's the bottom line. Our traditional digital health literacy, the skills we've learned for judging websites, it just can't protect us from these new AI-specific risks. We're talking about things like algorithmic bias, where the AI might give you different answers depending on your background. And of course, those confident fabrications, those hallucinations. We really need a whole new set of defenses.
And that brings us to the solution. It's a concept researchers have put a name to: Artificial Intelligence Health Literacy, or AIHL for short. Think of it as a new, dynamic set of skills built specifically to help us navigate this new world safely and effectively.
So, how do we actually build this new skill? Well, AIHL isn't just one single thing. It's really a package deal, defined by 4 core skills that all work together to keep you safe and informed. Let's break them down.
Okay, skill number 1. This is arguably the most critical one of all. It is all about questioning what the AI tells you. It's called critical appraisal. And what it means is you basically have to become a detective. See, the AI is generating answers based on statistics and patterns, not pulling from a fact book. So you just can't take its confident tone at face value. You have to actively fact-check everything against credible sources. You've got to be on the lookout for those hallucinations.
All right, next up, skill number 2 is all about recognizing the boundaries of the tech and its potential for harm.
Think of this one as your personal safety shield. It's called ethical and safety application. And really, it's about knowing what not to do, like understanding the huge privacy risks of typing your personal health info into a public chatbot. And for professionals, it's about knowing those ethical lines you just can't cross. Sometimes the smartest thing you can do is not use the AI at all.
Okay, skill number 3. This one's about becoming a better partner in the conversation with the AI itself.
Now this one, prompting and interaction competence, is really interesting because it totally reframes your role. It takes you from being a passive user to an active director. It's all about learning how to craft really precise prompts to get much better, more accurate results. You can even use it to simplify complex medical jargon, which is a huge game changer for bridging health literacy gaps. And finally, skill number 4. This is about making sure all this knowledge becomes a formal, official part of our education and our professional lives. It's called educational and professional integration. And what this does is it makes sure that our future nurses, our future doctors, all our health professionals, they get formally trained to use these powerful tools right from day one. It's all about aligning their skills with what their future jobs are actually going to demand.
Okay, so theory is great, but what does this actually look like in the real world? Let's walk through a story, a model case from the research. Meet Maya. She's a 21-year-old nursing student. And this example just perfectly illustrates how Maya uses all 4 skills together, like a toolkit. For critical appraisal, look, she spots a hallucination from the AI and immediately cross-references it with a real peer-reviewed database. For ethics and safety, she stops herself from typing in patient details, a huge no-no. With prompting, she skillfully writes a query to make a pamphlet easier for a patient to understand. And finally, for educational integration, she documents her whole process in her academic report just like she was taught. By putting it all together, she avoids harm and actually improves care. It's fantastic.
All right, let's zoom out for a second and look at the bigger picture here. Why does developing this skill, AIHL, matter so much? Why is it so critical?
Well, first off, AIHL doesn't just appear out of thin air. It's built on a really solid foundation. Number 1, you need to start with some basic health and digital skills. Number 2, our schools and universities have to actually integrate this training into what they teach. And number 3, and this is just as important, it takes the right attitude from all of us, a real willingness to learn and engage with this tech critically.
And believe me, the stakes could not be higher. The consequences are they're stark. If we have AIHL, we get improved patient education, better professional outcomes, and we can actually stop dangerous misinformation in its tracks. But without it, we're looking at direct patient safety risks, the wild spread of false information, and some really serious ethical breaches.
And just to be clear, this isn't just some casual idea someone came up with. This whole framework, the 4 skills, the foundations, the consequences we've been talking about, it's all the result of a really rigorous scientific analysis. Researchers synthesized the findings from 50 different academic articles to build this out.
So, when you put all of that together, we get to the official definition. Artificial intelligence, health literacy, is that dynamic skill set that enables us to use these new AI tools effectively, ethically, and safely, all so we can achieve our health goals while keeping those very real risks in check.
Ultimately, the goal is pretty simple, and it's exactly this. It's about empowering every single one of us, empowering us to become informed, responsible, and safety-conscious citizens in this totally new age of AI-driven health information.
And so that leaves us with one last, really crucial question to think about as we move forward. Is your AI literacy ready for the future of health? Thanks so much for joining me.